Modern surgery is built on precision, technology, and centuries of research. But what if many of its foundations were already laid over 2500 years ago? In ancient India, a surgeon documented procedures so detailed that parts of them are still recognized in modern medicine. This knowledge was preserved in the Sushruta Samhita. Historical background. Around 6th century BCE, in Kashi, modern-day Varanasi, lived Sushruta, widely regarded as the father of surgery. His work, the Sushruta Samhita, is one of the earliest comprehensive texts dedicated to surgical science. Unlike philosophical texts of the time, this was practical manual, focused on methods, procedures, and outcomes. A key strength of Sushruta's work was its focus on human anatomy. The text described hundreds of bones, muscles, and blood vessels categorized with functional details. To study the body, Sushruta recommended controlled cadaver dissection, preserving bodies and examining them layer by layer. This method reflects one of the earliest systematic approaches to anatomical science. Surgery was not treated as a single discipline, but as a structured system. Sushruta classified surgical procedures into 8 categories, including incision, excision, scraping, puncturing, extraction, drainage, probing, and suturing. Each category followed defined steps, showing an early form of procedural standardization. Surgical instruments. The Sushruta Samhita describes more than 120 surgical instruments. These include scalpels, forceps, needles, and probes, many designed based on animal forms for precision and control. This reflects an advanced understanding of tool design long before modern surgical engineering. Rhinoplasty. Among all procedures, one stands out for its innovation, rhinoplasty or nasal reconstruction. In ancient India, loss of nose due to an injury or punishment was common. Restoring it was not just medical but social. Sushruta described a method using skin graft taken from cheek or forehead, carefully shaped and stitched while maintaining blood supply. This principle, known today as pedicle graft, remains fundamental in reconstructive surgeries.
Anesthesia and pain management. In anesthesia and pain management, performing surgery without a modern anesthesia record innovations, and patients were given a wine and herbal sedatives to reduce the pain and induce a partial unconsciousness. While the limited by modern standard, it represents early scientific approach to pain management. Surgical training system. In training under Sushruta was highly structured, and students practice incisions on fruits, and suturing on clothes and leathers, and probing on woods. Only after mastering these techniques were they allowed to operate on real patients. This closely resembles modern simulation-based training medicines. Ethics and medical protocol. In ethics and medical protocol, equally advanced was ethical framework. Sushruta emphasized the patient consent and cleanliness and discipline, and as well as he advised to against treating incurable cases, highlighting responsibility over ambitions. These principles continue to guide modern medical practices. While some anatomical classifications differ from modern science due to evolving the knowledge and terminology, the systematic evidence based approach remains remarkably and advanced for its some time.